When was the last time you actually sat down, took off your socks, and really looked at your toes? Not just a quick glance, I mean really looked at the color, the temperature, whether one foot looks different from the other. Most people never do this, and I get it. Life is busy, and we tend to focus on the parts of our body that are causing us obvious pain. But here's what I've seen in over 30 years of practice. Some of the most serious health problems, problems involving your heart, your arteries, your blood flow, they show up silently, quietly, right there on your feet. I've had patients who came in for a routine checkup, and when I looked down at their toes, I immediately knew something was wrong. Not because they were in pain, not because they had any dramatic symptoms, but because of the color. Today, I want to share that knowledge with you, because you deserve to know what your own body is trying to tell you. By the end of this video, you will know exactly what each toe color means, which colors are completely normal, which ones are serious warning signs, and which ones mean you need to pick up the phone today. I'll also show you 3 simple tests you can do right now at home that I use with my own patients. So stay with me, because this could genuinely be one of the most important things you learn this year. Let me start with a simple idea that explains everything. Your heart is a pump. Every single minute, it pushes blood through roughly 60,000 miles of blood vessels, from the top of your head all the way down to the tips of your toes. Now, here's the thing. Your toes are the furthest point from that pump. They're at the very end of the line. So when something goes wrong with your circulation, when your arteries start to narrow, when your blood pressure drops, when there's not enough oxygen getting through, your toes feel it first. Think of it like water pressure in a house. If there's a problem with the main pipe, the faucet closest to the problem might still work fine. But the faucet at the very end of the line? That one shows you the problem first. That's exactly how your body works. And this matters especially if you are over 60. Here's why. As we age, our arteries naturally become stiffer and less flexible. The inner lining of those blood vessels can accumulate plaque, that's cholesterol and calcium, and the passages get narrower. Blood doesn't flow as easily. Less oxygen gets to the tissues. The medical term for one of the most common results is PAD, peripheral artery disease. And I want you to understand that PAD affects roughly 12 to 20% of Americans over the age of 60. That's not a rare condition. That's 1 in 5 or 6 people your age. And the majority of them have no idea they have it. The warning signs are there. They've often been there for years. But because the feet don't always hurt, people miss them. That changes today. Now I want to walk you through the colors you might see on your toes and what each one is telling you. I'm going to give you the color, the likely cause, how serious it is, and what to do. Let's start with the one we all want to see. Pink and warm, the healthy baseline. Healthy toes should be a soft, even, pinkish color. Not too pale, not too red, not blotchy. When you press on the skin and release, the color should return quickly, within about 2 seconds. The skin should feel warm, not cold or clammy. This is what good circulation looks like. If this is your baseline, great, but keep watching because I want you to know what to look for as things change. Pale white or very light. Arterial warning sign. If your toes look unusually pale, almost white, almost gray, like the color has drained out of them, that is a significant warning sign. What's happening? The small arteries supplying blood to your toes are either narrowed or temporarily closing off. Blood isn't getting through the way it should. Oxygen isn't reaching the tissue. This is often the earliest visible sign of peripheral artery disease. It can also happen with a condition called Raynaud's phenomenon, where the small blood vessels overreact to cold or stress and squeeze shut. With Raynaud's, you'll often see the color change come and go, white, then blue, then red, as blood rushes back. It's uncomfortable, but it's generally not dangerous on its own. But here's what I need you to pay attention to. If your toes are consistently pale, not just when you come in from the cold, but regularly at normal temperatures, you need to bring that to your doctor's attention. Blue or purple, oxygen alarm. This is the color that gets my attention immediately. Blue or purple toes, what doctors call cyanosis, means that the tissue is not getting enough oxygen. The blood is there, but it's carrying too little oxygen, or it's moving too slowly and the oxygen is being depleted before the blood can circulate back. There are several possible causes, and some of them are very serious. First, heart or lung problems. If your heart isn't pumping efficiently or your lungs aren't oxygenating the blood properly, your extremities will show it. Blue toes can be an early sign of congestive heart failure or a significant cardiac issue. Second, severe arterial blockage. If a major artery is significantly blocked, blood can pool and lose its oxygen before it reaches the toes. Third, deep vein thrombosis, a blood clot in the leg. This is an emergency. Now, I want to be precise here. If you press on a blue or purple toe and the color temporarily lightens, that means blood is getting there. It's just moving poorly. If you press and there is no color change at all, that is more concerning. If your toes are blue or purple and you also have chest pain, shortness of breath, or significant swelling, do not wait. Call 911 or get to an emergency room right now. Bright red when you let your feet hang down. Dependent rubor. Here's one that most people have never heard of, but it's one of the most important signs I teach my patients to look for. It's called dependent rubor. Here's how to spot it. When you lie down and raise your feet, your toes might look pale or slightly drained. But the moment you sit up and let your feet hang down, the toes and the bottom of your foot turn a deep, dusky red. Not a healthy, flushed pink. A dark, almost angry red. What's happening? The arteries are so narrowed and damaged that they can only let blood through by gravity. When your feet are at heart level or above, blood can't push through. When they hang down, gravity assists, and the blood floods in. But it's coming in sluggishly. It's low in oxygen, and the tissues are responding with this alarming redness. If you notice dependent rubor, that is advanced peripheral artery disease. This needs to be evaluated by a vascular specialist. Please do not ignore it. Brown or rust-colored staining, venous insufficiency. Now let's talk about a different type of color change, brownish or rust-colored patches on the skin, usually around the ankles and lower legs, sometimes extending to the toes. This is called hemosiderin staining, and it tells a different story than the arterial problems we've been discussing. This is a venous problem, meaning it involves the veins that carry blood back to the heart, rather than the arteries that bring blood out. When the veins in your legs aren't working well, a condition called chronic venous insufficiency, blood pools in the lower legs. The pressure builds up, and tiny amounts of blood start leaking out of the vessels into the surrounding tissue. The iron from those red blood cells leaves a brownish stain that builds up over time. You'll often see this alongside varicose veins, ankle swelling at the end of the day, or a feeling of heaviness in the legs. It's not an emergency the way an arterial problem can be, but it is a chronic condition that can lead to skin breakdown, ulcers, and infection if left untreated. It's worth discussing with your doctor. Yellow toes. Multiple possible causes. Yellow toes deserve a moment of attention because they can mean several different things, and it's important to figure out which one. The most common cause, and I see this constantly, is a fungal nail infection. The nail and surrounding skin take on a yellowish, thickened appearance. It's very common in older adults, especially those who've worn tight shoes or spent time in public pools or locker rooms. It's not dangerous, but it should be treated. A second cause is lymphedema, when the lymphatic system isn't draining fluid properly, causing swelling and sometimes a yellowish discoloration. This can develop after cancer treatment, particularly if lymph nodes were removed. Third, in some cases, a yellow color to the skin, especially if it also appears in the whites of your eyes, can indicate liver problems, a condition called jaundice. This requires immediate medical attention. The key is to compare the color of your toes to the rest of your skin. If the yellow is isolated to the nails, think fungal infection. If it involves the skin and you're also feeling unwell, swollen, or your eyes look yellow, call your doctor today. Red, hot, and swollen. Inflammation or emergency. If a toe, or multiple toes, suddenly becomes bright red, hot to the touch, and swollen, that combination is your body screaming for attention. There are three main possibilities. 1. Gout. This is an extremely common condition in adults over 60, especially in men. Gout happens when uric acid crystals build up in a joint, most often the big toe, causing sudden, severe inflammation. The pain can be intense, and the toe can look almost purple-red and feel hot. It comes on fast, often overnight. If this sounds familiar, talk to your doctor about uric acid levels and dietary changes. 2. Infection or cellulitis. A cut, a blister, or even an ingrown toenail can introduce bacteria into the tissue. For people with diabetes or poor circulation, this can escalate quickly. Red, warm, swollen skin that's spreading. Don't wait on that. 3. And this is the one I want you to take most seriously. A deep vein thrombosis, or a clot in the foot. This requires imaging to confirm, but if you have significant swelling and redness in one foot and not the other, combined with warmth and pain, seek medical attention promptly. Small purple or blue spots on the toes. Blue toe syndrome. I want to end this color section with one that's less common but extremely important. Small, irregular patches of blue or purple appearing on the toes, often without much pain at first. This is called blue toe syndrome, and it is caused by tiny pieces of cholesterol plaque or very small blood clots breaking off from larger vessels and traveling to the small arteries of the toes. The medical term is microembolization. What makes this so critical is what it tells you about what's happening upstream. If small pieces are breaking off and reaching your toes, there may be significant plaque buildup in major arteries, potentially including the aorta or the femoral arteries. This dramatically increases your risk of stroke, heart attack, and other serious vascular events. Blue toe syndrome is not a wait-and-see condition. This is a call your doctor today, possibly an emergency room today, situation. All right, now I want to give you something concrete you can do the moment this video ends. These are 3 tests I use with my own patients in the clinic. They're simple, they're safe, and they can give you real information about your circulation. Test 1. The capillary refill test. Sit comfortably in a chair. Take off one sock. Press firmly on the tip of your big toe with your thumb for about 3 seconds. Then release quickly. When you press, the skin under your thumb will go white. That's the blood being pushed out. When you release, you're watching how fast that color returns. Normal, color returns within 2 seconds. That tells you blood is flowing freely through the small vessels. Slow, 3 to 5 seconds. Circulation may be compromised. Very slow, more than 5 seconds, or the color doesn't fully return. This is a sign of significant circulation impairment and should be evaluated. Do both feet and compare. If one foot refills noticeably slower than the other, that asymmetry itself is a red flag. Test 2. The elevation dependency test. Lie down flat on your bed or couch. Raise both legs up to about a 45-degree angle. You can prop them on some pillows. Hold this position for about 60 seconds and observe the color of your toes and feet. Healthy circulation. Feet remain pink. Concerning. Feet turn pale or white, even in a warm room. Now sit up and let your feet hang down over the edge. Watch what happens over the next 60 seconds. Healthy. Color returns to a normal pink within about 15 to 20 seconds. Concerning. The feet turn dark red or dusky, that dependent rubor I described earlier. Or the color takes a very long time to return. This is exactly what a vascular specialist will do in their office. Now you can do it at home. Test 3. The temperature comparison test. This one is beautifully simple. Sit down and use the back of your hand, which is more temperature sensitive than your fingertips, to feel both feet. Slowly move from your heel to your toes on each foot. Pay attention to whether one area feels noticeably colder than another, and whether both feet feel the same temperature throughout. Healthy, both feet roughly the same temperature, warm throughout. Concerning, one foot noticeably colder than the other. This can indicate that an artery on that side is narrowed or blocked. Also concerning, a significant temperature drop as you move from the ankle to the toes on the same foot. This suggests the blood isn't reaching the toes effectively. Write down what you find from these 3 tests. Bring that information to your next appointment. Your doctor will be grateful you came prepared. Now, everyone benefits from knowing this information, but there are certain groups who absolutely must take these signs seriously because the stakes are higher. If you have diabetes, this one is critical. Diabetic neuropathy, which affects many people with long-term diabetes, damages the nerves in the feet. That means you may not feel pain, cold, or discomfort, the signals that would normally tell you something is wrong. The only clue you might have is a color change. Check your feet every single day. If you see anything unusual, any color change, any sore that isn't healing, any swelling, contact your healthcare provider immediately. If you smoke or have smoked, tobacco causes direct damage to the inner lining of blood vessels and accelerates plaque buildup. Smokers are significantly more likely to develop PAD. Even if you quit years ago, your vascular risk remains elevated. Be extra vigilant. If you have high cholesterol or a history of heart disease, the same process that builds plaque in the coronary arteries builds plaque throughout the body. What you see in your toes may be reflecting what's happening much closer to your heart. If you have high blood pressure, chronically elevated pressure damages the arterial wall over time, making vessels stiffer and more prone to blockage. One final important point. Don't look at color in isolation. Combine what you see with what you feel. Are the toes numb or tingly? Is there cramping in your calves when you walk that goes away when you rest? Do you have any sores on your feet that are slow to heal? Combine these clues and you get a much clearer picture. I never want to leave you with just problems. I want to leave you with solutions. So here's what I recommend. First, make a 30-second morning habit. Every morning when you get out of bed, before you put your socks on, take 30 seconds to look at your toes. Check the color. Do the capillary refill test. Feel the temperature. You are now equipped to do this correctly. Catching a change early is the single most important thing you can do. Second, move every day. Walking is one of the most powerful treatments for peripheral artery disease and one of the best things you can do to prevent it. Even 20 to 30 minutes of gentle walking a day stimulates the development of collateral circulation, tiny new blood vessels that essentially create a bypass around narrowed arteries. Your body has this ability. Give it the movement it needs to use it. Third, if you smoke, please stop. I know you've heard this before, but I'm telling you as your doctor, there is no single lifestyle change that has a more dramatic impact on vascular health than quitting smoking. It's never too late for your vessels to begin healing. Fourth, manage your blood sugar and cholesterol. If you have diabetes, keep your blood sugar as well controlled as possible. If you have elevated cholesterol, work with your doctor on diet, exercise, and if appropriate, medication. These are the two biggest drivers of arterial plaque. Now, when to call your doctor versus when to call 911. Call your doctor soon, within a day or two, if you notice pale or white toes that don't resolve, brownish staining around your ankles, one foot consistently colder than the other, slow capillary refill, or any new color change you haven't seen before. Go to the emergency room or call 911 if you have blue or purple toes with chest pain or shortness of breath. Sudden onset of cold, pale, and painful foot. This can indicate an acute arterial occlusion. Small purple spots appearing on multiple toes. One-sided leg swelling with redness and warmth. Finally, I strongly recommend asking your doctor about a test called the ankle brachial index, or ABI. It's a simple, painless, non-invasive test that compares the blood pressure in your ankles to the blood pressure in your arms. It's one of the most accurate ways to screen for peripheral artery disease. If you are over 65 or over 50 with risk factors, this test should be part of your routine care. I started this video by asking you a simple question. When was the last time you really looked at your toes? I hope now you understand why that question matters so much. Your toes are not just the ends of your feet. They are the readout of your entire cardiovascular system. They are telling you, right now, whether your blood is flowing freely or struggling to reach its destination. They are showing you, before any pain or major symptom arrives, whether something needs attention. All you have to do is look. So after you close this video, please do this one thing. Take off your socks. Run the capillary refill test. Look at the color. Feel the temperature. Do it on both feet. And if you see something that concerns you, don't dismiss it. Don't wait 6 months until your next scheduled appointment. Pick up the phone. That small action could genuinely change the trajectory of your health. I care about each and every one of you watching this. That's why I make these videos, because I know that information shared at the right time can save lives. If this video helped you, please give it a thumbs up. Leave a comment below telling me what you found when you checked your toes, and share this with someone you love who might need to hear it. And make sure you subscribe, because coming up next, I'm going to show you what the bottom of your feet reveals about your liver and kidney health. You are not going to want to miss that one. Until then, take care of yourself. You deserve it.